81,000 deaths a year are due to overdose in this country. That's 8 people every hour and 130 people a day that die in this country, in this United States, due to overdose. Opioid addiction, overdose is the leading cause of death for those who are over 50 in this country. Isolation brings on more opioid use and misuse. Isolation brings on more mental health crisis. Hello, I'm Pastor Mark Pearson. I'm sitting in the sanctuary of our congregation, our church, Turner African Methodist Episcopal Church, here in the city of Atlanta. And for the last few months and weeks, our doors have been closed to public worship and public congregating. We've been in the midst of several crises in this country and in our community. The first crisis that has been on the scene is that of the coronavirus known as COVID-19, and it had created a health crisis. And then immediately because of the health crisis, we created another crisis called unemployment and an economic crisis. And then soon after the unemployment and the economic crisis came on the scene, shortly afterwards, we are experiencing a crisis of justice, of social justice, and of social action. We have been advised and we have been told that we must shelter in and that we must social distance ourselves from others. But in doing that, we create another crisis, which is that of health, and that is a mental health crisis. Isolation creates a very problematic situation of mental health. And so we decided that we would present to you and invite you to take a part and be a part of this virtual tour. Welcome to this virtual testimony and tour. I want to introduce you to Mr. Juan Davis and share with you his family's story. Juan Davis is the average hardworking American father, dad, husband, and he's an avid motorcyclist and bike rider.
My name is Juan Davis. I am from Atlanta, Georgia. I am 58 years old, praise the Lord. And I'm proud to tell you that I have recovered from opioid addiction due to medical disabilities. I've had 5 hip replacements and 4 pop-outs. I am a retired United States veteran, and I retired from the Department of Veteran Affairs. Opioid addiction can happen to anyone strictly because of consequences. But the most important thing I say to anyone that's dealing with it is to face it up and let your loved ones know that you're having some issues with it. My folks noticed after the 5th occurrence with the hips that I had became dependent to the point to where I was on morphine. And morphine is, as they say, that's a tap out drug. But my family would not allow me to give in to the addiction. And they prayed with me, and along with my support group, with my military, my friends, everybody that knew me, I was able to recover. And the one thing that helped me recover was I'm a media guy. And God gave me a vision of a Vice, which was this trailer that I designed. It's a mobile media center. I went on lockdown for about a year and a half and designed this trailer so I could understand me. It was time for me to do me. I had no one touch it, no one even in the garage with me while I was working on it. Yes, I tore it apart 200 times. However, while I was doing this, I was reestablishing my confidence in being a needed person again. My family was missing me. People in my industry was missing me, and God gave me an opportunity to be needed again. And in running with that, my church reached out to me and said, "We need you as well," which gave me a greater desire and a need to belong in order to recover and stay clean from opioid addiction. I'm proud to say that I don't use any opioids or any other medication other than maybe an occasional Tylenol or here and there, or some Blue Moon. If it's extreme and I'm riding hard, I may have to take a tramadol. But now I pray a lot. I stay focused. I stay involved in giving, helping, and in my church, and staying very, very committed to honoring the agreement that I made with God. If He got me out of that bed of 6 years of dealing with hip replacements and opioid abuse, I would serve Him with all of my talents. So as a recovered person from opioid use, I say to anyone, take back your life. Pray, let someone know you're having some problems. If you need me to help you walk through this, I will. God bless you, and thank you so much for listening to my story. Hello everyone, I am Boom 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 Box. That's my motorcycle handle, y'all. For those who really know me, you know I really love biking. I like to make sound on my bikes. From years ago I was a DJ, and I'm still a DJ. So I was given this name by another motorcycle club that I was DJing for. If you ever become a biker, we're gonna call you Boom 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 Box, and that was TD with Black Angels. I build motorcycle sound systems. I design trailers. I am a media guy. I do all elements of media, and I'm here to help anyone. I go around and I try to make everyone happy with my melodic sound and also the theme of what I do with the motorcycle. They call me Santa Boom during Christmas time. I ride with the trail attached to the bike. I pull up for the needy children. We give them out toys and stuff. I dress like Santa. That's why they call me Santa Boom. If it's Easter time, I will come up dressed like Peter Cottontail, pulling something from an Easter spirit to show what my commitment is to that season. But again, I'm here for anyone. I do sound, media, and I work very diligently with my church in training and trying to enhance the media department there, and just trying to make everything work well. I am so thankful that I'm able to give back. And I just thank the Lord every day for getting up, and I get up out of bed and I roll and go give and help someone. You cannot receive a blessing with a closed fist. You must open your hands and give in order for God to give to others.
I am Reverend Dr. Von Wrighton, the coordinator of addictive disease initiatives in the Department of Behavioral Health and Developmental Disabilities. I'm also the state opioid treatment authority for the Department of Behavioral Health and Developmental Disabilities. And in my role as the state opioid treatment authority, I have influence and some level of clinical oversight over all of the opioid treatment programs in the state of Georgia. Also, in my role, I serve as the state opioid project coordinator, and those funds are grant funds from from Substance Abuse Mental Health Services Administration. It comes to every state to provide substance use services, particularly for individuals with opioid use disorders. One of the projects that we're currently working on is a project called the Faith Initiative for individuals with substance use disorders and focused on the opioid crisis. Over a year ago now, just about a year ago, the Department of Behavioral Health launched this Faith Initiative to work with faith leaders and to empower, to train and develop faith leaders to be in faith communities to be able to respond to the opioid crisis effectively. Why? Because faith leaders are absolutely essential. They are first responders in many ways to this opioid crisis. People come every Sunday and then throughout the week seeking help from pastors and from imams and from rabbis and from people from all faiths of walk have this issue. And so we really do need our faith leaders to be able to respond, to be effective in this. And so we worked all year long with a cohort of faith leaders, along with the Clinton Foundation, to train and to raise awareness and education for the faith community. One of the key things that we did in the faith community is, with this project, is we worked to make sure that people understood, what happens when someone has, when they overdose. Well, what happens when that happens? And what are the signs and symptoms of that? And what is the drug that we use to reverse overdoses? And so we trained faith leaders in how to use Narcan, which is called the overdose drug. And we prepared the faith leaders by helping them to be able to see, what the overdose looked like. And then we wanted to also, help faith communities understand the language of recovery, because language matters. How you talk about people with substance use disorders makes a huge difference in the stigma that comes associated with it. One of my great passions is for people to know that the issue of substance use disorder is not a moral failure. It is not a moral failure. It is a disease. It's chronic, progressive, potentially fatal, and it is curable, and it is treatable, and people do recover. And so this is what we have done with the faith community, and I'm happy to be able to partner with Turner Monumental African Methodist Episcopal Church in this effort for them to respond and engage the community, engage you to learn more about this opioid crisis and how to respond. I want to thank you for allowing me to greet you, and I want to thank you for allowing me in the state of Georgia to serve you as your state opioid treatment authority and coordinator. Thank you. So in partnering with the Clinton Foundation, the Department of Behavioral Health has replicated a model of gathering faith leaders from the community to respond to the opioid crisis. The Clinton Foundation is a great partner, and they've done a tremendous amount of work to prepare resources, to help us prepare resources in the community, to connect providers and faith leaders to how to respond to this crisis, and to be able to get people to care when it's necessary. And so we partnered and we replicated that. Now this is already taking place in Texas, I believe, and in Arkansas, and so it is the mission, I think, of the Clinton Foundation to really take this nationally. We are grateful for their partnership in the Department of Behavioral Health. We've taken all of our resources and thrown it behind this effort in the state of Georgia. My vision, long-term vision for the state of Georgia, is to move this around from community to community. We've started in Metro Atlanta, but we're going to go much further. And in Georgia, we continue to educate faith communities. Even right now, we're planning and developing an online training for faith leaders to be able to respond. So this is an ongoing effort. And so it's been replicated, but we're taking it quite a bit further here in the Department of Behavioral Health and Developmental Disabilities. So thank you.
Hi, my name is Reverend Dr. Karma Johnson, and I am the Minister of Christian Education at Turner Monumental AME Church in Atlanta, Georgia. Our senior pastor is the Reverend Mark S. Pearson. Turner is located in the 6th Episcopal District under the leadership of Bishop Reginald T. Jackson, and on the East Atlanta District, where I serve as Christian Education Director under the leadership of Presiding Elder Dr. Thomas Bess. Turner Monumental has been blessed this year with a partnership with Greater Smith Chapel under the leadership of Reverend Marcus Harvey and the DeKalb County Board of Health. We were able to form the Kelly Initiative, the Kirkwood Edgewood Healthy Living Initiative. And at Turner Monumental, for us, that means a lot. Healthcare and Christian education go hand in hand, but it's not something that is new to African Methodism, as we follow in the footsteps of our founding bishop, Richard Allen. Richard Allen was instrumental in the yellow fever epidemic that happened 200 years ago in helping and aiding and assisting people who suffered from that dreadful, deadly disease. And here we are 200 years later in the midst of a COVID-19 pandemic. Add to that all of the other health care disparities that we suffer in the African American community. Healthcare issues that run the gamut of heart disease and hypertension and kidney disease, all of those things that are instrumental for COVID to set up in our bodies. So the healthcare initiative with Kelly at Turner Monumental is very important. It is a part of Christian education that we really want to focus in on, because even though we are suffering in this health crisis of COVID-19, there are many other issues that continue to plague us. One such issue is opioid addiction. Each month, the Kelly Initiative talks about a different area of healthcare. We have been able to partner with organizations like Morehouse School of Medicine and AIDS Atlanta, and we talk about how our bodies function and what we need to do to allow them to function better. So during the beginning of the year, we had a healthcare symposium that talked about our healthy body levels. We looked at our glucose level and our blood pressures and our BMI. We even looked at our feet to see how instrumental foot health is with the rest of our body health. We looked at our HIV/AIDS statuses to make sure we knew where we stood. Those are some of the things that we did, not just for adults, but for children too, who suffer with healthy body image and healthy food choices. So we were able to address those issues as well. So coming at the end of this month, on top of what we already offer, weekly exercise and challenges like the hydration challenging and walking challenges and exercising and keeping the body movement. On top of all of that, this month we will partner with the Clinton Foundation and talk about the opioid crisis. Even though we're in the midst of a pandemic, regular everyday crises will still hit us hard. And in the African American community, the opioid crisis has been something that has been plaguing us for a very long time. But it wasn't until a lot of public figures were dying from opioid addiction or talking about how they were affected by opioid addiction did it come to the forefront. So we are blessed to partner with the Clinton Foundation to offer opioid education and intervention.